the firing pattern at any given time is what we experience. And that also includes our emotional state. There are areas that are responsible for how we feel. There are areas that are responsible for joy, for fear, for anxiety. And we know that in different conditions like depression or schizophrenia, there are parts of this complex organ that are malfunctioning. There are circuits that are too active or underactive. And the idea behind TMS is rather than try to normalize those areas in a very indirect way by taking a medication in your mouth and having it go through your digestive tract and getting absorbed into your blood, where it can produce side effects throughout your body, and then being crossing over into your brain, where it can affect all the areas where that chemical has a role, just to normalize or to regulate some malfiring in one area. The idea behind TMS is we can do this much more elegantly and selectively through technology. And TMS is essentially a device that focuses a pulsating magnet at an area that's not functioning well, and acts like a personal trainer for that area, and will stimulate it because we know from physics that a pulsating a magnetic field will cause these brain cells to fire. And so it will non-invasively stimulate that area, and over time, that area, just like somebody who has an injury and needs physical rehabilitation, over time that area will start to function more normally on its own.
Okay, how do you actually do that though? Talk us through the process.
So the process is, for depression, we know that there's an area on the left side towards the front of the brain called the left prefrontal cortex. So when patients come in and we deem that they're appropriate for this, what we'll do is we will sit them in a chair, and we have a cap that has a coordinate system on it, so it maps out their skull.
And if people actually want to see this, if they go to your website,
right,
kadimanu.com, is that?
It's Kadima, Kadima, N as in Nancy, P as in Paul for neuropsychiatry.com.
Okay, so if they go there, there's actually like video footage of this, so they can see like how this treatment's administered.
Exactly.
Okay.
And so what we do is on the first day, we map out where the depression area is, and then it's a very straightforward process. They come in every day. It's not a fast process, but it's sort of like physical rehab, or if you were out of shape and overweight and you got a personal trainer to kind of change that would take time. You couldn't go to the gym one day and expect that
to run a marathon the next.
Exactly.
Yeah. Okay.
So they come in every day, and we stimulate that area of the brain. It takes about 30 minutes a day. It's quite benign because there's nothing invasive. There's a helmet that sits on top of their head, and the beam is aimed at the particular area we're trying to strengthen. And they come in every day. They don't feel much at all. Maybe a little bit of a light tapping on their skull, because we actually don't. An interesting fact is we don't feel our brains. Our brains cannot feel sensation from themselves. They receive input from everywhere in the body. So when we feel any sensation, that's impulse coming from the nerves in that area coming to the brain and being translated into a painful or pleasurable sensation in the brain. But a neurosurgeon can cut into a person's brain while they're awake, and they would feel nothing. Because
really?
Absolutely.
Oh my goodness.
You can go on. There's plenty of YouTubes of that if you're so inclined.
Wow. Make sure you're not watching that on a full stomach.
No. So it's an interesting fact that the brain can't feel itself, it feels the rest of the body.